So a year and a half ago, I graduated dental school and have been a practicing dentist ever since. So I thought I'd make a video and talk about my transition from being a exhausted, stressed out, full-time dental student to now being a exhausted, stressed out, full-time dentist. What's going on, everyone? For those of you that don't know me, my name is Dr. Simran Singh, and in today's video, I'm going to talk about the major differences between being a dental student and a dentist, and just talk about my experiences overall and just how the transition was. You know, everyone's experience in dental school and just transition overall is unique to themselves. So I thought I'd just share with you my experiences and just how it went for me. But yes, let's talk about how life has been as a dentist and how my transition went. You know, everyone's experience in dental school is unique to them, and it is a very rigorous and stressful process to get through. You spend the first 2 years of dental school relearning the science courses that you took in undergrad, and of course, you never use it in the profession. To this day, I've learned the Krebs cycle 5 times and yet have still not used it once. And of course, you're drilling on plastic teeth, you're given a paper with criteria, and you gotta follow the exact dimensions that are given and make sure you do well enough to pass those competencies. And towards the latter half of dental school, you're putting all that practice that you put into simulation lab onto actual patients. You have to meet certain requirements to graduate and of course pass the exams that you have both in dental school and both with the written boards and the CDCA. So yeah, dental school was very difficult. You could not pay me to go back because I've had some of my most stressful times in dental school, but transitioning into real world dentistry is completely different and has its own stresses as well. One of the first major differences and one of the more difficult transitions that I had was patient interaction and just the overall clinical procedures that you do on a day-to-day basis. You know, as a dental student in dental school, you are doing the jobs of multiple people on a dental team. You are the dental assistant, you are setting up your clinical chair, you are taking the x-rays, you are taking down patient information, you're also the dental hygienist. You know, you're getting the probing depths of those patients, you're doing the cleanings, you're doing the scaling and root planings, and you are also the dentist doing all the main dental procedures like the restorative work, crown and bridge work, partial denture work, complete denture work, oral surgery. So you are doing the job of the entire clinical dental team essentially, but you're doing it a lot slower and you have faculty constantly overseeing you. You know, when you're doing those procedures in particular, faculty is always looking over your shoulder, making sure you're doing that procedure correctly, making sure you understand why you're doing that procedure, and making sure that the quality of your work is up to standard. So in doing that, you'll probably see 2 to 4 patients at most a day. As a general dentist, I can assure you, unless your patients don't show up, you are not seeing 2 to 4 patients a day. I know for me, the most amount of patients that I ever saw was 4 patients a day in dental school, and you will spend anywhere from an hour and a half to 2 to even 2.5 hours on doing one procedure in particular. You know, when I went to dental school, screening a patient, taking their x-rays, and doing the complete comprehensive exam, that could take anywhere from 2 to maybe even 3 appointments. You know, depending on where you work, you can see anywhere from 12 to maybe even 20 patients. I know some people that even see more than that. So the volume amount of patients you see is a lot more. So your productivity and efficiency definitely has to increase. And honestly, it has to increase the moment you get out. That aspect of the transition can definitely be very difficult because we come out of school thinking and doing procedures in a specific way, but in private practice and as a general dentist, it is completely different. And at first, it's definitely very difficult and can be very overwhelming, but as your experience increases, it definitely gets a lot better. So the volume of patients is definitely one of the major differences between being a dental student and dental school without question. Another difference is the business of dentistry and just the overall management of the dental team. As I mentioned earlier, when you're in dental school, you're essentially the dental assistant, the dental hygienist, and you're basically organizing what patients can come in and out. You obviously get some help from the school and just the faculty in general, but you are doing most of that work and it is very independent in most cases. I know it was for me. But as a dentist, you are working with the dental assistant, you are working with the dental hygienist, you are working with the people who are working the front desk. Every single aspect of the team needs to be working up to standard in order for the dental practice to function well. You know, you have to make sure that your dental assistant is trained to do the work that you can do so that way you can do good quality work and do it efficiently. And sometimes you have to have those hard conversations that dental school does not teach you. You have to make sure that their work is up to par, that they're communicating with patients well, that they're doing everything in the offense efficiently. You come to learn that the entire dental team is a very integral part of the success of not only the dentist, but the practice as a whole. You know, as a dentist, like sometimes you have to have those difficult conversations with your dental assistant, with your dental hygienist, with your team manager, and sometimes they have to have hard conversations with you. You'll come across people with 20 to 30 plus years of experience. They've come across and worked with so many dentists, and you know, sometimes they may have feedback for you that you have to make sure that you're able to take in. You know, every person who is part of the dental team is a very integral part of the success of the practice as a whole. You have to make sure that the communication between the team members is good and that the expectations are set. And sometimes you have to have those difficult conversations with people. And also, you as the dentist has to be receptive to criticism, because some of these people have a lot of experience. They've been in the profession for 20 to 30 years, you know, longer than you've even been alive. So sometimes you have to be receptive to criticism in order for the practice to function. So communication has to be very good. You have to make sure communication is there, that you're always receptive to criticism. You're always setting expectations out there, and that's something dental school doesn't teach you. So yeah, that's definitely one of the major differences between dental school and just being a dentist, is having those communication and management skills with your dental team. So another major difference of being a dental student versus a dentist is the stress you encounter. You know, when I was a dental student, I was constantly stressed about the next exam, passing a practical, passing a competency, passing my boards, passing the CDCA. I wanted to make sure I did everything I could to graduate, and that stress was constantly bearing on me because I wanted to become a dentist and get to that next step. And I'm sure for most people, whether you want to be a general dentist or specialized, that stress is very similar. You know, you're doing everything in your power to make sure you're doing well on exams, you're passing, you're getting your requirements, so on and so forth. But the stress you feel as a dentist is completely different. And some people may think it's better, some people may think it's worse. I personally prefer being a dentist and prefer dealing with that stress, but you know, some people preferred dental school and like that stress better. But yeah, the stress you deal as a dentist honestly varies on a day-to-day basis. First, from a patient management standpoint. When you're a dental student, you're seeing patients and you always have faculty there to help and even bail you out in some cases. You know, it can be very stressful as a dentist, especially when you're first starting out, when you're doing procedures and things don't go a certain way and you don't have anyone to bail you out. And trust me, I've been there, and it can be very difficult to deal with. So from a procedural aspect, it can definitely be overwhelming, especially when you're seeing a lot more patients, you don't have the constant guidance, and it's really all on you when you're doing those procedures. But I can tell you, every single day it gets better and better. You know, you will struggle at times, you will make mistakes, but as long as you are better than the person than you were yesterday, you know, and continuously improve, it becomes better and better and less stressful as you move on. And it's not just patient management from a procedural standpoint, but just patient management from a communication standpoint. You're going to come across a lot of patients that are very upset, and they might not even be upset at you, but they're just upset in life, and sometimes they take it out on you. And that can be very difficult to deal with because, you know, you as a dentist have to make sure you're professional with the patient, you are talking to them in a professional manner, but sometimes you just have to take it. And honestly, there are even times that you may do a procedure and you tried your best and the outcome wasn't as good as you want it to be or the patient wanted it to be, and they'll take it on you as well. But the most important thing with that aspect of just the profession itself is just, you know, you do your best for the patient. Just keep in mind, you can't make everyone happy, and just, you know, stay professional and just genuinely know at the end of the day that, hey, if I did my best, that's all I can ask for. You can't make everyone happy. So that's always a good mentality to have, because especially when you start out early on, there are going to be days where things just do not go the way you want it to. And you're sitting there, sometimes you're sweating, you're trying super hard to make sure the outcome of a particular procedure or just like communication with the patient is going well, and it just doesn't. So yeah, just like patient management from both a procedural and a communication standpoint, that stress can be very difficult to deal with. But you know, at the end of the day, just keep in mind, like I said, you can't make everyone happy. You just have to make sure that you as a dentist is doing your best. And outside of just the patient management, you might just have stresses that'll hit you out of nowhere. Sometimes a procedure that you think will only take you 30 minutes will end up taking 2.5 hours, and your entire schedule is backed up. and all the staff is getting upset at you because you are behind. But sometimes stress just hits you out of nowhere, and there's gonna be days like that. But like I said, as long as you are doing your best and really just doing things within your limitations, you just kind of have to step back, take a breath, and just be like, all right, I did my best. We're gonna be better tomorrow. And yeah, in general, there are just so many different stresses as a dentist that dental school just can't prepare you for. Whether that be just finances from a patient, dealing with insurance companies, dealing with issues with the staff. There are just so many things that can occur on a day-to-day basis that can also just be so unexpected. So you just really have to do your best and be prepared for it. But let me tell you, the stress that I'm dealing with now is way better than the stress that I'm dealing with dental school. So it does get better. But yeah, all in all, the transition from being a dental student to a dentist is difficult without question. You know, dental school cannot prepare you for real world dentistry. You don't even scratch the surface in terms of the procedures and the skill set in general that you need to have to become a dentist. And even me being a year and a half out, I'm not even remotely close to what I want to be in terms of knowing which procedures to do and just my skill set in general. Every single day I want to make sure that I'm improving, but I know I really do have a long way to go. But in all honesty, it truly is a blessing to be in the position I am today. People do have their faith and trust in me to do the best work possible for them. And even though in this videos I did talk about the stressful aspects of it, there are days that you go home with the biggest smile on your face because you made an impact in a patient's life. So it's super important to just make the most of every day you have, continuously learn, and just do as best as you can in the profession. But yeah, I hope that video was insightful. I hope it was helpful. I'm going to be making more content. I know I haven't made it in a while, so if you guys have anything in particular that you want me to talk about, please do leave it in the comment section below. But I genuinely appreciate you guys for watching, and I hope you have a blessed and beautiful day.